At the end of this module, you will be able to recognize parts of the EKG and identify sinus and atrial rhythms. We will be looking at lead 2 unless otherwise indicated, since lead 2 is our rhythm recognition strip. The yellow line is showing the isoelectric line, and that is the baseline and represents the absence of electrical activity. The straighter this line is, the more accurate the EKG reading will be. In lead 2, everything should be above the isoelectric line. The P wave, the QRS complex, and the T wave are all upright. Be sure that you have P, QRS, and T waves in each complex. Remember that the P wave represents atrial rate and the atria contracting. The QRS complex, or the R wave, represents the ventricular rate and should correspond with the patient's pulse. The T wave represents ventricular repolarization. The next step is to determine both atrial and ventricular rates, the P for atrial, the R for ventricular. There are several ways to do this. The easy ones are accurate in regular rhythms only. One way is to count the number of R waves in a 6-second strip and multiply by 10. In this case, there are 14 R waves, so the heart rate would be 140. There are also 14 P waves, which means the atrial rate would be 140. The other way is to count the number of R waves in a 3-second strip and multiply by 20. There are 7 R waves in a 3-second strip, so the heart rate is 140. And there are 7 P waves, therefore the atrial rate is 140. Slow or irregular rates, you really should count at least 10 seconds, and in this case, the strip is not long enough. In order to count fast rhythms, you find the R wave that falls on a heavy line and mark it, and then count as follows in the example to the next R line. You do the same with the atrial rate by looking at P waves. This, again, is only accurate in regular rhythms. If we look below at our example, we estimate that both the atrial and ventricular rates are just under 150. Now we need to determine the regularity of both the atria and the ventricles. If irregular, we need to determine whether it has a pattern to it, being regularly irregular, or does not have a pattern, and we call that irregularly irregular. We measure across the entire strip. We start at either the P waves or the R waves, and I typically start at the R. I measure from the first R to the second R using a straight edge, put a dot on that straight edge, and then measure across. Then I do the same for the P waves. We next need to be sure that there is a P wave in front of every QRS complex. If not, are there P waves after the complex, or are they just absent? We look at each QRS complex and be sure that it is occurring after every P wave. There should be a P, then QRS, then T, in that order in every complex. Once we determine that, we look at the length of the PR interval. The PR interval we measure at the start of the P, and we end at the start of the Q wave. and that should be consistent across. The PR interval should be 0.20 seconds or less. Another way to state this is less than 0.21 seconds. This particular slide is showing how and where we measure the start to the end of the PR interval. We also need to make sure that the QRS complex is less than 0.12 seconds in width throughout. In this case, where the arrow is, it is two small boxes, which is 0.08 seconds. Now it is your turn to try to interpret a few examples of EKGs. The answers will appear after about 1 minute. If you need to go back and review the slides again, then go ahead and do that. Now we're ready to start going through the questions to start determining rhythm interpretation. Answer the questions in the following order. What is the atrial rate? What is the ventricular rate? Is the rhythm regular, regularly irregular, or irregularly irregular? Is there a P wave in front of, behind, or possibly hidden in a QRS complex? Is it upright in lead 2? What is the length of the PR interval? What is the width of the QRS complex? And then from those answers, you can determine what this rhythm is. On another note, you do not need to buy calipers. You use a piece of paper, mark the start and the end of the rhythm from the first to the second complex, and then measure from there. A quick side note on abnormal heart rhythms. Vagus stimulation of the parasympathetic nervous system can do a few things. One, it decreases the rate at the SA node and can cause a bradycardia, and it also decreases the excitability of the AV junction fibers. It slows the heart rate and in severe cases can cause a complete blockage of impulse through the AV junction, causing a heart block of varying degrees. Sympathetic stimulation has opposite effects than vagal stimulation. It increases the rate at the SA node, it increases the rate of conduction and excitability throughout the heart, and it increases the force of the myocardial contraction, which in turn increases the workload of the heart. Another issue that can happen is a small area of the heart can become more excitable than normal. This causes abnormal heartbeats called ectopic or ectopy. Ectopic foci or ectopic beats are caused by irritable area in the heart. This irritability can be caused by ischemia, stimulants such as nicotine and caffeine, lack of sleep, or anxiety. We'll now look at different rhythm interpretations. Inside the box of each gives classic definition or explanation of each type of dysrhythmia. As previously discussed, the SA node is the primary pacemaker in the heart. Sinus beats originate from the SA node. The examples are the sinus rhythm, sinus bradycardia, sinus tachycardia, and sinus arrhythmia. The sinus rhythm we'll look at first is the normal sinus rhythm. Normal sinus rhythm has atrial and ventricular rates that are the same and between 60 and 100. The atria and ventricle are both regular. There is a P wave in front of every QRS. There is a QRS after every P wave. The PR interval is less than 0.21 and consistent throughout, and the length of the QRS complex is less than 0.12. In this particular example, we see 4 P waves or atrial beats in 3 seconds, and we see 4 R waves or ventricular beats in 3 seconds. Therefore, the atrial and ventricular rates are 80. Sinus bradycardia is a sinus rhythm whose rate is below 60, typically 40 to 59. The ventricular rate is also the same as the atrial rate, and both the atria and ventricular rhythms are regular. There is a P wave in front of every QRS. There's a QRS every P wave. The PR interval is less than 0.21 and consistent, and the length of the QRS complex is 0.12. In this particular example, the atria and ventricular rates are 40. There are 4 P waves in the 6 seconds, and there are 4 R waves in the 6 seconds. It is possible to see this as a normal variation in people who are athletes, someone with a fairly slow rhythm during sleep, or in response to a vagal maneuver. If slower than the SA node pacemaker, typically slower than the 40 to 60, it is possible that the patient will have a junctional rhythm. Sinus tachycardia is a sinus rhythm with a rate greater than 100 and typically only about to 160. There are some sources that say 150 is the cutoff. Atrial and ventricular rates are the same. The rhythm is regular. There is a P wave in front of every QRS complex and a QRS complex after every P wave. The PR interval is less than 0.21 and is consistent throughout, and the QRS complex is 0.12 or less. In this example, the atrial and ventricular rates are 120. There are 6 P and 6 R waves in the 3-second strip. The clinical significance of this depends on the underlying cause. Sinus tachycardia is typically caused by things like increased catecholamines, congestive heart failure, hypoxemia, pulmonary embolism, increased temperature, so fever, stress, or even pain. We don't treat sinus tachycardia, we treat whatever is causing it. Sinus arrhythmia is a sinus rhythm that has a regularly irregular pattern to both the atria and ventricles. The atrial rate can be anywhere from 45 to 100, and the ventricular rate is the same. Looking at this 6-second strip, you can see there's a variation, and if you had a long enough strip, you would see a pattern. There is a P wave in front of every QRS, a QRS after every P wave. The length of the PR interval is less than 0.21 and is consistent throughout the strip. The length of the QRS complex is 0.12 or less. If you look at this and watch the person breathe, you will see that the rate increases with inspiration and decreases with expiration. The rhythm is most commonly seen with respiratory changes due to fluctuations in vagal tone. Non-respiratory form is present in diseased hearts and sometimes can be confused with a sinus arrest or sinus pause that we'll discuss later. Treatment is not required unless the person also has a symptomatic bradycardia. In this 6-second strip, we see that the heart rate for atria and ventricular rates are 70 and irregular. Now it is your turn to try to interpret a few examples of EKGs. The answers will appear after about 1 minute. If you need to go back and review the slides again, then go ahead and do that.